in fact, I think you have replied. So this, acha, now important thing, Dr. Saab, what I wanted to ask you is this tests and all, Dr. Saab, it is taking 4 to 5 days now in this second,
Yes.
this after this COVID wave. So can we go ahead and start taking medicines? Because I think some people also go for this CT scan and all those things. But in most of the cases, I have also found that like doctors are advising, I don't know how correct it is. I think you are the best judge. Can we start taking medicines in advance, like all these water COVID related vaccines before getting the test report?
So it's very interesting thing, and
Okay.
really we are taking around 4 days to 2 days for getting this COVID reports. So during that time, actually, what we are practicing and what doctors in Vizag and all my colleagues were practicing was treating on symptomatic treatments. Once if there was a classic COVID symptoms of the person, and still no need to wait for the getting the test result done, and he can start the basic medications of basic antibiotics and fever medications, and some immunity boosters like vitamin zinc, and vitamin zinc, vitamin C, and vitamin D. Then they can start using those medications without waiting for the test report. And as you said that there is a separate prophylaxis course for that thing without not getting COVID. Then nothing is separate prophylaxis course. It's just the immune boosters. They will boost your immunity. So nothing there is separate separate medications are not there for that for not preventing from them COVID. There are separate medications that will boost your immune system. Nothing more than that.
Yeah. Okay. Okay. So you like we have to conclude it. Yes, we can like start
Yeah, you
this.
can
Is it?
you can start basic medications if you're having a symptoms of COVID related symptoms.
Okay.
Not
Basic
wait for
medicine.
that results. And HRCT, it's all done in an advanced way.
Absolutely.
And some
Absolutely.
doctors say that X-ray is more sufficient rather than going for the HRCT.
That's okay. So I think this I think the previous question was very important. I think, and so Dr. Saab, the sixth question, like this time, Dr. Saab, what we are noticing, this time, what we are noticing that this time children are also getting affected. Okay, like affected in the sense, I should not say very high mortality rate and all, but like they are basically getting affected. So what you have to say about this, Doctor Sir?
Yeah, childrens are getting affected. This what we
Mm.
also see, but there is a big protection for the children who, because they will have the vaccine called as MR vaccine, and previously it has a MMR vaccine. Now we had got a MR vaccine. The kid or the child who have completed this dose of MR vaccine will have some sort of protection from this COVID infection. And of course few kids were all few children of few children and few teenagers were also affecting with this COVID this time, because I has already said you that the COVID had a mutant itself, and lot of mutants came in came th- a lot of mutants were there in this there in the there in the there in our country and in the world at present. These were affecting these children also, but mortality rate for the children and hospitalization rate for the children were very much less when compared to the others, because children will having a good immune system, and recently they got vaccinated, and that vaccines will have the good immune system for the children. And MR vaccine, which they have got MR vaccine. MR means measles, rubella vaccine, which they had got, and that having a positive effect on protecting children from this coronavirus.
Okay, fine, fine. Doctor Saab, another important question now is there that like recent some reports we have seen, like I think you only have to stamp it whether like it is correct or not. In fact, recently we have seen like even a mother, if like she is getting affected, and then like in case of newborn babies, we are seeing that the newborn babies are not getting affected. So like that's what I want your comment, like how true it is. But there are some reports I have seen in the latest in the last couple of days. Even I have read also.
Yeah, it's completely true that even we had recently there were two, three surgeries of this and for pregnant women who were COVID positive, and there is separate ward for that in our Vizag KGH hospital. There is a separate ward for the COVID and antenatal mothers, and they are waiting for the delivery time, and even they are positive, the newborns were not getting affected. As I said you that there is a there is a transport or there is a pass of the virus system for the mother and this thing, and but that can't be pass over the placental medium, which has which has a connection between the mother womb and the children. So that passage is not establishing. Once the child was delivered to the from the mother, and we are separating that child from the mother from for the 14 days, and we are making a strict protocols for the for the childrens and neonates to not to be with their mother for the couple of weeks. Once she was fully recovered, then the child can go back to the mother. But the transportation medium is not there for that virus, because
Okay.
usually the placenta will be there between for the mother womb and for the child. That route of transmission is not there for the virus, luckily. So most of the times they were newborns were not much not getting
Okay,
affected.
okay, okay, okay. Well noted, Doctor Saab. Well noted. Now, I think we are still uh, in recovering in a recovery stage of COVID. Now there has been something called as black fungus, and now I don't know something yellow also. I heard, I could not conclude it. So now, what all these? I think new things are coming. In fact, I think if I'm not wrong, Puducherry was in Tamil Nadu a little bit most affected part. So, like, what is it, Doctor Saab? What is this black fungus and how it is related to this
Black
COVID?
fungus, sir, is nothing a new thing. It's already old thing. It's already there from past many years, and we had seen this black fungus thing many years. Why now this becoming more prominent? For that, so black fungus will not affect for the all participants, and I mean affect for the, all the persons who got exposure for the COVID, and only for the person who were having a low immunity, or their blood sugar control was not in control. Those kind of persons were having this effect, were having effect for this black fungus. So it's nothing need to worry. There are standard protocols and treatment guidelines for the black fungus, and black fungus is a scientifically called as mucormycosis. So this disease is there from past many years. So we need to do a symptomatic treatment for that this mucormycosis, which also called as a black fungus. But this is not affecting all the persons, all people who were admitted in hospital and were discharged from the hospital. It depend upon the immunity system of the person. If having a low immune system, and he is a diabetic and is very in uncontrolled, then they might have the chances of getting black fungus with a little low spread rate. And there are particular treatment and guidelines for the black fungus, and it's not much harmful at this present scenario and situations.
Okay, okay. I also want to tell our viewers that as I said, we are having this questionnaire with us, which is being prepared by our committee. And after that, we will also try to take some questions from that chat box. So let us first of all finish these questions. Maybe like whatever you wanted to ask, it might be here. So just like keep patience, and after that, at the end, we will also try to take those questions from the chat box. So, Doctor, Sir, one more thing I want to ask you: this during second wave, I think many people like we have seen that without symptoms also they are being tested positive. So, how do we recognize them? Like this what something? No, we are
Yes,
discussing.
absolutely. We see that many patients symptomatic without their non-symptom. This is the main thing. Even they were not having any symptoms, and might they have some minor symptoms of fever, cold, but they were neglected. But they might get test positive. There is a particular scenario for the testing the patients, and they were differentiated into their primary contacts and secondary contacts of the positive patients. So we are going to identify that. So if a X person is a positive, so we are going to talk with them like who are your primary contacts and whom you met in past 3 to 4 days. So we are selecting them as a primary contacts, and we are testing them. Even we are testing them, we find that if the person is non-symptomatic but he is getting a positive thing, and might be he's having a immune system. That was his so his symptoms were not so he was not so his symptoms was not appearing, but then the gradual after 2 to 3 days he is developing symptoms. So there is nothing thing that he won't have symptoms. He will have symptoms, but during the testing phase it won't have symptoms. But after 2 to 3 days he will be getting those symptoms.
Okay, okay. Now this another question is very important question, Dr. Saab. Actually, in the last 1.5 months, if you see from, I should say from April, whatever 12th to whatever May 15th, we have seen like this second wave. I think this last 1 month was very difficult. I have seen like some people. In fact, there were no beds in the hospital. Still, there are like we are still going through this crisis situation. Now, I have seen that some people got cured by home quarantine, and some other are basically facing problems. And in some cases, Dr. Saab, we have also found, unfortunately, I should not say, but the truth is that many of them are also dying because of like unknown, like what are maybe COVID related reasons. So, what are the reasons for this? It's a little bit like troubling all of us. So, I thought I should
Yeah,
ask you.
it's completely still there are a lot of no appropriate answer for this from my side and from expert side also. Like it was the way of nature of virus was completely unpredictable. So even my friend so recently having a very high infection of the score. Like if he for the CT score 25 out of he's having a score of 24 out of 25, and he got cured and he came out. And recent person who having a CT score, say, severity, I mean chest severity index score of 10 or 14, so they were not able to make out. So the way and the way of this thing of the virus grow and replication was completely different from the person to person. And it's also thing like the person having a comorbid conditions. So if you're having a comorbid conditions is nothing but a person having a diabetic or hypertension or any liver disease or any lungs problems or any heart problems. In those conditions, the virus replication is getting more faster than the healthy person. So
Okay.
that might be the one of the scenario why the people were affecting more commonly, and why the death rate is more there, and why the hospitalization rate is much
I
much more
think
there.
like after hearing this answer, I must tell you that like more research needs to be done.
Yes, obviously,
There
yeah.
are some still no dark spots. Okay. Now, Doctor Saab, like in this something people now this virus has affected the lungs. What I could get a sense very badly. Immediately, people are rushing for what they call it CT scan, and in fact the continuous CT scan is also not good. But in some cases where it goes beyond limit, people are like it is turning out to be very bad. So what is it like it this has got a direct this COVID has like directly it is affecting the lungs, and you want to say no other parts, or like what it is?
Yeah, no, no. COVID not only affecting the lungs, so it's affecting many parts of the body. Like it's important thing, like oxygen supply is a must and should for the lungs, as well as the oxygenated blood need to be transported to the many other parts of the body. So and the blood is not having a sufficient amount of oxygen. It can't be transported to the many other parts of the body. For example, hearts, lung for heart needed oxygenated lungs, oxygenated blood. Brain needs also oxygenated blood. So less amount of oxygen in the blood, were not less amount of oxygenated blood is not a good sign. So hearts also heart is also affecting, and even brain is also was affecting to for supply of the less oxygenated blood. And even a new thing, new main reason for the death of the COVID patient was like it's a medical terminology called as microthrombi. Microthrombi is nothing but if you see the vessels of your blood vessels, there are some small clots will be there. Usually we'll say it as a blood clots, but in the medical terminology we call them as a microthrombi. These microthrombi was affecting these blood vessels, and which obstructing the flow to the lungs and flow to the heart, and it's causing it. So that is the one of the fatality rate is very high due to the effect of this microthrombi. So we can't say that virus is having only effect to the lungs, and other part of the body also was being affected and is being affected by this virus. But lungs were the majorly affected, but that impact is there in the other parts of the body.
Oh, okay, okay, Doctor Sir. I have actually noted this. Now, this is another very important question, Doctor Saab. Even I had also gone through this. In fact, let me also quickly share. I also visited this Apollo hospital during last 10, 12 days. In fact, there I had seen that what I want to ask you, can lying on the belly really improve the oxygen levels? Because I had seen there in the emergency ward, okay, concentrator and all those, they were giving it to patients, but most of them were lying actually on the belly. So, like, what you advise that, like, does this have an impact? And let me tell you, I had a very good experience, and I it really helped basically. Not only to me, but like even I heard on in fact, I have seen on WhatsApp and all also many messages got exchanges pertaining to this. So, what do you have to say that oxygen levels for COVID patient in home isolation condition, does it really help
Yeah,
sleeping on the belly?
it's really helpful. It's really helpful and scientifically proved. And if a person having a less oxygen level, he need to sleep in a prone position. It's called as prone position because that how you need to sleep on your belly and having two pillows on the chest part. So it's really helpful, and with that will help in expansion of the ribs and the lungs part. So having a proper oxygen supply to the lungs, and that will be really helpful. And you can also purchase some kind of breathing exercise machines called as spirometers, which will have a three kind of balls will be there that you need to blow out your air from that pipeline. So that was very available for a very cheap cost, around about 300 or 200 bucks. You can get it from medical shops or surgical shops. So you can practice that thing for improving your lung capacity. So these two things can be done, and one more thing was like breathing exercise. So you can download that breathing exercise thing from many internet and YouTube's, and you can go for that breathing exercise. These three things can help most of the time for improve your
Yeah,
oxygen levels.
yeah, but I have like what all my little bit experience says, it sounds good, but you again need to practice this, because people say and then immediately nowadays